Sexual dysfunction is common in both diabetic men and diabetic women. It's particularly prevalent in men with diabetes, and the most common complaint is erectile dysfunction or impotence in men with long-standing diabetes. And what they will complain of is an inability to achieve an erection that's firm enough to allow for sexual intercourse. They may also notice a lack of nighttime erections. And many of these individuals have normal interest in sexual activity, but have an issue with performance. The good news is that there are lots of different treatment interventions for erectile dysfunction or impotence. The first thing, as with all forms of diabetic neuropathy, is to improve their blood sugar control. And sometimes that alone will lead to an improvement in sexual performance. If that doesn't work, there are 3 tablets that have been developed, the first of which was Viagra. There's also Cialis and Levitra, all of which work by a similar mechanism. They improve blood flow to the pelvic region and allow for a better erection. Unfortunately, in the studies done to date with these drugs, the diabetic patients do the poorest with these agents, and that's because erectile dysfunction or impotence in diabetic men is due not just to an issue with blood flow, but also due to neuropathy effects of the pelvic region. So if they don't respond to the erectile dysfunction meds, then the next step is usually to measure hormonal measurements. And we specifically look at testosterone levels in men with diabetes. And a high percent of these men will have very low testosterone levels. So we treat them, if appropriate, with supplemental testosterone. And oftentimes that will allow them to have normal sexual function. If we do these above measures and we aren't able to help the patient with his sexual function, then we consider alternative treatments. And there are a number of different agents. There are some medications that are given by injection, which will help with sexual performance. There are also vacuum erection devices, which are applied externally and can help the patient have a successful erection. And last resort is an implantable, surgically implantable penile implant, which will allow the patient to perform normally. So there are a lot of new treatment options for treating erectile dysfunction or impotence, and many of these will lead to normal sexual performance.